Hello, everyone. It's Friday, May the 14th. We've had 8 additional deaths since Wednesday. Very respectfully, we want to read those first, and then we've got a good little bit of information. We're going to get through it as quickly as we can. The 2,749th death is a 53-year-old male from Mingo County. The 2,750th death is a 70-year-old male from Lewis County. The 2,751st death is a 74-year-old male from Berkeley County. The 2,752nd death is a 68-year-old male from McDowell County. The 2,753rd death is a 29-year-old male from Mineral County. You know, they list these, and this one was underlined, and I thought it was really the break between 2 days, but I didn't know that, and so I just hate it. Gosh, I hate it for all, but boy, that's bad. Our 2,754th death is a 93-year-old female from Mason County. Our 2,755th death is a 69-year-old male from Grant County. And our 2,756th death in West Virginia is an 85-year-old female from Marion County. You know, for almost all of us, the sun's shining, and right now there's a bunch of kids, you know, with communities and schools, and they're out in the boulevard doing the chicken dance. And it's good to see our kids, you know, having fun and doing good stuff and everything. And it's easy to maybe possibly forget, you know, just forget or you know, that all these people that, you know, we've lost. And so nevertheless, I just hate it. I hate it so bad. Don't forget them. Don't forget them. Keep them in your prayers and remember them, please. We have 297 new positive cases in the last 24 hours. Our daily positivity rate is at 4.47. Our cumulative rate is at 5.13. Our active cases are 6,615, and our recovered cases are 148,552. We have 255 hospitalized in West Virginia and 86 patients that are in the ICU unit. We have 1 red county, and that's Hampshire County. It's hard to believe. I mean, you know, really and truly, this terrible killer doesn't discriminate, does it? I mean, sometimes it's in the Eastern Panhandle, sometimes, you know, it's in an area that is maybe less populous. It just doesn't discriminate. And so we've got to remember that, and we've got to still take this thing really serious. If you're 65 and above, please go get tested if you have any kind of any kind of symptoms whatsoever. You know, from the standpoint of the antibodies, they can help save your life or save your life if we can catch this early enough. Now, the CDC yesterday came out with something. I loved it to death. They came out and lifted the mask guidance and everything. But they announced yesterday that anyone that is fully vaccinated, now make sure everyone understands this, anyone that is fully vaccinated can participate indoors and outdoors in any activities without wearing a mask, in anything, irregardless to crowd size. Again, this is for those folks that are fully vaccinated, which means that you have had both your shots, other than if you've taken Johnson & Johnson, and you have had 2 weeks after the second shot. And so, and the same is true with Johnson & Johnson. If you're taking Johnson & Johnson, you have 2 weeks after your Johnson & Johnson shot. So today, I am also announcing that I am signing an executive order to modify our face covering requirement. And we will immediately begin following the updated CDC guidance for all those West Virginians that are fully vaccinated. Our face covering requirement no longer applies to you if you are fully vaccinated. Our face covering requirement will still apply for all those that have not been vaccinated until June the 20th. Remember, you do not have a constitutional right not to wear a mask. But the bottom line to this whole thing is just this and only one thing. Any private business or school can still require you to wear a mask, irregardless of this new executive order and this new guideline by CDC. So, with all this being said, it's a good day. It's a great day. From the standpoint of us that are fully vaccinated, to be able to walk around and not worry up with this crazy mask stuff and everything, even though it has saved so many lives. We want to give it a good burial. For the ones that are fully vaccinated, we want to absolutely tell that mask how much we appreciate it, even though it's been terribly cumbersome and it's been invasive and all that. We know that. But at the same time, we also want to appreciate it because it served its purpose, and what a purpose that it served. It saved so many lives. Now, I don't know that there's a motivator out there that can possibly be any better than this. For those that have not been vaccinated, for crying out loud, you don't like the mask, go get vaccinated. Go get vaccinated as quickly as you possibly can and everything, so where you can share in this enjoyment and everything that's going on as well. Now, it's going. You'd probably, to be able to really take advantage, you're going to probably have to take Johnson & Johnson and then go 2 weeks. But you could surely beat the June 20th deadline by 20 days or more if you'd go now. So I encourage in every way. I'm excited about more good news, and I want everyone to understand with all in me that I respect all constitutional rights of everyone. I absolutely do, but our private and our public facilities and everything, where you're going in and out of those and everything, we have got to continue to work towards getting more and more and more folks vaccinated, and we're going to continue to do that. And we're on a pathway, really and truly, to have a whale of a celebration on June the 20th. But for right now, we've got a surely happy day today as well. On June the 20th, through our Call to Arms initiative, I've set that date for the mask mandate to be fully lifted. We're keeping that date. And, if you get vaccinated, in the very near term with Johnson & Johnson, you'll be able to get rid of this mask probably 20 days before our June 20th date. Okay, I talked to you a little bit on Wednesday about the unemployment dilemma and our small businesses across our state, all of our businesses really struggling with trying to fill jobs. We have now checked it out with Workforce and checked it out pretty good. There's about 24,000 people, I think that was the right number, that are now still currently unemployed, and that they're receiving this extra bump from their unemployment every week, and so there's 12 I think states right now that have. Instead of letting that go on all summer, letting our businesses, be upside down and struggling in every way in the world to be able to take care of their business and take care of their customers and on, those businesses really know that our people should be back to work. And I agree with that wholeheartedly. Now, there's got to be some people that are still out there that are really struggling, and I'm not talking to you. But I'm talking to the overwhelming majority of those other folks. Now, so here's what we're going to do. We're going to follow suit with the other 12 states. So actually, what we're going to do, we're going to give everyone a little more than 30 days. That gives Workforce and everybody the ability to put this into action and everything and what we're getting ready to do. But today I am announcing that we will end all federally funded pandemic unemployment compensation programs in West Virginia effective June the 19th at midnight. West Virginians will have access to thousands of jobs right now, and we need everybody back to work. Our small business and economy depends on it so much. This will include the additional $300 weekly payment as well as benefits for self-employed. Any weeks filed before June the 19th that are eligible under the federal program requirement will continue to be processed. Workforce West Virginia stands ready to help West Virginians return to the workforce. More information on this will be provided in the days to come. In addition to this, we are, and it will take me until Monday to put this in place. But what we're having a lot of businesses that are willing to step up, and we're looking at, some kind of bonus that could really incentivize our folks to go back to work and really be able to help with this shortfall that they may, have to endure just a little bit here. But we got to have you back to work. America is all about work. And, that's what's made this great country. And for us to not be back to work, if you're just taking advantage of these programs or whatever like that, I think that time is over. And that time needs to end, and we need to move forward. But in addition to that, what we're looking at is the state doing a $500 for all practical purposes signing type bonus. And if it is equaled by a business that you would go to work for that is willing to put up the same dollars. So if some business out there and we've had a lot of discussions with businesses along this line, if some business was out there would be willing to put up $500, the state put up $500, the employee gets $1,000 to go back to work if you stay on the job for a minimum of 90 days. And so we're looking at that. We're also looking at, from the standpoint of this is not in a situation to where, and we're trying to address this and everything. If you're working now and you just transfer jobs and go to work somewhere else, we're not interested in that. We're interested in getting these folks back to work here that are on the sidelines right now. So I'll let you know more on Monday, but as of June the 19th, we're going to halt this program. Our vaccine eligibility is all 16 and above. The FDA and the CDC have now authorized the Pfizer vaccine for all 12 to 15-year-olds, and we have begun that vaccination, and I think General Hoyer is going to talk more about it. We have 15 counties that are scheduled to hold clinics next week. The Department of Education estimates 78,000 folks, or kids that are eligible. And we will offer the vaccines to all students 12 to 15 years of age with the permission of their guardians. And all these clinics will also offer vaccines to all eligible West Virginians as they come in, whether they be students, parents, or educators, whomever it may be. So Brooke, Boone, and Putnam counties are holding clinics this week in schools for 12 to 15-year-olds. Our young people stuff, we're moving right ahead, with our $100 gift card or savings bond issue and all that. And someone sent me a note, is that on the savings bonds there? Everything. Well, that doesn't have anything to do with it. I'll get back on course here, but for all those 16 to 35 years of age, go get vaccinated. We'll catch up as far as sending you that $100 either gift card. You'll be the one to decide. A $100 gift card or the savings bond. We'll hook you up on how to get that. But either way, one way or another, we're going to get you those dollars, and we got that all teed up in the system right now, and I think that's going to be run very, very smoothly. From a standpoint of our vaccine distribution update, we're at 83.9% of first and second doses administered by the state this week and everything. Our goal is always 100. We've got 72% of those 65 years of age and older that are fully vaccinated. Over a third of our population has been fully vaccinated. You know, actually that number is, I love this thing keeps moving. We're at 46.9% fully vaccinated in West Virginia. Now here's the number you got to really watch. Remember, we're trying to get to 65, you know, and everything. On all people that, you know, are in the state of West Virginia that are eligible, that have received first dose. And we're at 56.2% of the total population right now. Remember, that number was, I don't know, it was 51 or 2, and then it climbed and we got to 53, then we got to 54. I thought, my gosh, this is really great. Then we were like 54.8 or 9 or something, and then all of a sudden we were at 55.2 and everything, and now we're at 56.2. You know, I think yesterday or Wednesday rather, I told you we had 8.4% to go. You know, if I'm doing my math right, well, I think we're at, we were at 9.4% to go, and now we're at 8.8% to go. I think that's correct, and everything. So we're getting there. We're really getting there and getting there fast. So, you know, we're over 80% of our 65 years of age and older. And our call to arms goal is to get that to 85, get our age 50 to, you know, above 50, or 50 to 65 year olds to get that to 75%, and get all of our people to 65%. We don't have to get there. We'll get there really close to June 20th. June 20th, the masks are over. But we forecast everything, and we are absolutely on track to be right there, or really close on June 20th. Over and over, I tell you that our businesses and our churches, please call us, and we'll set up to vaccinate your congregation or your business and your employees. All you got to do is call. Our vaccine info hotline is up there. You know, our state parks are vaccinating like crazy, and all that's really good. On Memorial Day weekend, we'll be at all of our state parks, and we'll offer vaccines to all the employees' families, all the park guests, anyone that wants to come and get vaccinated at that time. And we're doing clinics all over our state parks. Those people have done phenomenal work. You know, we're transferring 6,000 doses of our Johnson & Johnson vaccine. We've had it for a little bit too long, and you know, it's starting, you know, it's going to expire on June, in early June. And so we got these 6,000 doses that we want to be able to help take care of our neighbors, and we're transferring those 6,000 doses to Delaware. You know, we currently have on hand, get these numbers, 33,000 doses of Pfizer, 20,000 doses of Moderna, and 20,000 doses of Johnson & Johnson. So, and we can immediately continue to order hundreds of thousands of doses. So all that's good stuff. You know, we're good to go there. All of our free testing is up. You know, we thank Frith, we thank Walgreens over and over. I encourage to get tested, and get tested. It seems like we may possibly have, you know, a misprint or whatever in the total number of doses that we have in warehouses and everything. You know, I'm not sure that that be the case, but if that number was wrong, General Hoyer, when you get on, please correct me on that. Our outbreaks in our long-term care facilities have jumped up just a little teeny bit. We have 17. We have 8 active outbreaks in our churches in 5 counties. That's Greenbrier, Hardy, Jackson, Nicholas, and Ritchie counties. Corrections update, we have 13 inmate cases and 7 staff. Phenomenal job there. You know, from the standpoint of giving blood and plasma and everything, I really highly recommend that you do that, especially if you've been